South Carolina NAACP held a press conference this morning raising concerns about possible discrimination amongst executives in the Department of Mental Health.
The organization claims that there's an attempt to reduce black executive leadership within the department. Investigative reporter Derek Rush attended this morning's press conference and has more details.
The new organization chart for the Department of Mental Health executive seating takes effect March 18th, which is today. Now, those changes are comprised in a bill, and it's aimed at improving mental health resources throughout the state of South Carolina. But that doesn't come without scrutiny.
I can't speak for them. I think it's a crisis.
Changes left to a vote in the General Assembly are drawing tall accusations.
There appears to be an orchestrated attempt to reduce the African American leadership in the department.
Eleanor Odom Martin says she worked with the Department of Mental Health for at least 30 years, 15 of those as Human Resources Director. At this morning's press conference with the South Carolina chapter of the NAACP, Martin illustrated her claims.
Okay, Chief Nursing Officer, that role is going away.
Saying a new bill that looks to merge 6 of South Carolina's health agencies moves several departments to the supervision of the Department of Veteran Affairs. Departments, she says, were previously supervised by the only black woman in an executive position within the department.
Now, they're going to tell you that it's not a demotion because right now they're not touching titles and money. So technically they're saying based on the state standards that it's not a demotion. But it is a major demotion in scope of responsibility.
The department responded in part saying this is an opportunity to treat those patients in all 3 of our focus areas: our community nursing home, inpatient, and those who receives services in their communities. President of the state chapter of the NAACP highlighting the potential impacts of these changes, with lawmakers raising questions of their own.
For many, many employees that are working at the Department of Mental Health, causes unrest, unhappiness, and that impacts on patient care.
And I think, yes, we want to streamline, yes, we want to save money, but at what expense? I think the number one priority must be the level of care that we offer to individuals.
In Richland County, Derek Rush, WIS News 10.
The Department of Mental Health also says there have been no layoffs, demotions, or promotions in relation to these changes.